Anyway, I'm not going to be on camera, and my questions are not going to be on camera. So,
I repeat the question.
yeah, if you can repeat the question or include the question in your answer.
Okay.
That would be great. All right, you ready?
Mm-hmm.
All right, I would like you, if you could, to tell us about your experience leading up to your need for a kidney and then your finding a donor.
Well, my experience is not, part of my experience not any different than a lot of other people who have diabetes or high blood pressure, hypertension as you call it, or in the South they call it sugar if you have diabetes. And I've had this for some 20 odd years. And the first level was detection. I didn't know I had it. It just happened one day. I wasn't feeling well. I had constant headaches, etc. And went to the doctor and said, well, have you been tested, for diabetes? Diabetes runs in my family. My grandmother had diabetes. My 4 sisters had diabetes. I have it. It skipped my mother. She didn't have it. She had hypertension. So that's sort of the history of a lot of people, and this, particularly in the black community. It's more prevalent in the black community than it is anywhere else. And so I'm a victim, like a lot of other people. In August of a couple of years ago, my creatine was decreasing every year, measuring my kidney function, and it got down to about 40% in August of a couple of years ago, 2 years ago. And my nephrologist, as they all do, said, let's do dialysis. I said, no way. I know some other options. I'm going to explore them. I did the same thing with my prostate cancer. I've been 15 years cancer-free on December 5th. The doctor made a recommendation for surgery. I explored all of that, because that's my chemistry in me, I guess. And more people should do that. Don't take one physician's advice about what you ought to do. You ought to see what's all out there. And I talked to Dr. Callender, who I'd known. He showed me all the film about transplants and the value of it, etc., etc. And I decided to do it. Then I was blessed. There was nobody in my family. 3 of my sisters have passed, so you couldn't use them. My oldest sister has diabetes herself, so you can't use her. My nephew is not sure, but he has some other kind of medical things. My son has some medical impediments that makes it impossible. And so I'm talking to a good friend of mine, who I've known about 8, 9 years, Kim Dickens, like I'm talking now. And I said, I need a living donor. And she said, I'd do it if our blood types match, or I said, you're just kidding with me. She said, I'm serious about that. Went to Howard the next couple of days and got tested. I'm B negative, she's B negative. She's 47 years old, vegetarian for 20 years, in the gym every other day. And she's a perfect candidate. God did that. And they scheduled it for the December 29th, 08. That was 3 days for my swearing in. I said, no way. And we rescheduled it for the February 20th. And I had apprehensions, she had apprehensions. But thank God I did it. It was not rejected. Here we are, probably a year and 4 or 5 months later. I have more energy. Now my people say I look a lot better. I feel a lot better. And I'm going to set up a foundation on kidney transplants and diabetes. From a governmental point of view, I'm looking into the possibility of requiring every medical professional to test for diabetes. And then we have to figure out how you get people to go get treatment for it, because it is, some of it can be done through diet and through exercise. Some of it is too hereditary oriented. You got to take insulin or some other things, but you can minimize it. Some of it's caused by obesity and not diabetes. So there are a lot of causes of it, but we got to get people aware, get them compliant. There was a time I wasn't compliant. I would eat all the things I wanted to eat. I was just being silly. Didn't think it made any difference. But I learned later that what you eat and the kind of food you eat can make a big difference in whether or not you have renal failure, kidney failure.
I think your idea for a foundation is brilliant, to have doctors test for it, but in the Black community in particular, a lot of our people don't go to the doctor. So what are the things that we can say or do to educate people? I'll tell you, it was not until I was aware of this that I understood that there was a connect. I'm an educated person. I didn't know there was a connection between diabetes and renal failure. I didn't know. So how do we get people to know this kind of thing?
Well, I think in Washington, about 94% of the people are covered by either Medicaid, by the Alliance, or by Medicare. And so people in D.C. are seeing their doctors. They have Medicaid, they have these other kind of things. So our big level is education in terms of prevention. You know, what do you need to do? You need to have courses in schools that talks about nutrition. In fact, the council just passed a healthy school program requiring certain nutritional things in our schools. And I'm getting ready to move to try to get these corner markets to use fresh vegetables and fruits. Not use, but require them to have them. And the council just passed a tax on these snacks, not going as far as I want to go. I think it ought to be banned. I don't think we ought to have all this just sugar in our community. It causes decay, it causes people to be hyperactive and all this kind of stuff. So it's just going to take the whole city mobilizing behind it, not just those of us who are advocates, not those who have that problem, but the whole city. The D.C. government has been derelict, been very derelict in doing this. We spend $9 billion. If we spend $500,000 on education, we are very lucky. It's been awful. And so we just had to get people aware of it. You got to get people compliant. Mm-hmm. That's an individual thing. As I said, I wasn't compliant at some point. I'm compliant now. I'm going to tell you a real interesting story. Probably about 2 or 3 years ago, I go to Howard University for all of my medical treatment. And I was there for something. I can't remember exactly what. I wasn't in the hospital. I was to get my blood drawn. I was doing something. And came out in the parking lot. You know, I'm a rather popular person because of the services I've done in the city. These 5 guys were in this van. And they were, hey, Marion Barry, that kind of stuff. I went over there, and all 5 of them had both of their legs amputated to the knee. And I just dropped. I almost went into shock. I said, oh my God, if I weren't compliant, I'm gonna get compliant now. Seeing that, I mean, some people had to see that, you know, to let them know. As I said, when I was non-compliant, I said, well, it's all right to eat this sweet, this pie. I was a fanatic for what's that? Lemon, limes. One of the pies that are very, very sweet. Lime something. And I couldn't resist it. I was working on Connecticut Avenue after I came out of office. And California Pizza had the best key lime pie there was. And so I was up there. I get 2 pieces of it. I said, oh my God. So then I decided this ain't right to do. So I stopped going to California Pizza. So the best thing to do is stop being around that kind of food if you can't resist it. And also cook healthy, eat healthy, get your children eating healthy, get them exercising, get them learning about diabetes and the impact of it. It's similar to sickle cell. We had to do a lot of work to get people acclimated to what sickle cell is about. A lot of folks in the community, a lot of folks in the Black community, thinking what they don't know won't kill them. I tell them it will. The other problem we have in the African American community is donating kidneys. I don't know what it is about us. I don't know whether it's culture, whether it's religious. I don't know what the heck it is. But it looks like we're going to take it to heaven with us. I tell people, at the cemetery, you don't see a U-Haul truck back up there with anything in it. You might as well give it to somebody to save a life or help somebody. Look at me. If Kim had not given me this kidney, I'm sure eventually I'd have found one because I'm just that aggressive about it. And it usually takes 4 or 5 years. Also, one of my first projects with the foundation is have a couple of days marathon with using various radio stations, working with Howard, working with the regional group here to get people to pledge to donate their kidneys.
You are working to make some concrete changes in this problem in the district, which, as we know, has the highest incidence of people with kidney failure in the country. So we know that it's a problem here. How can this be addressed nationally?
Well, first of all, you have to get the National Institute of Health and get all the federal government apparatus behind this push. Not just rhetoric, but fund, studies on diabetes and other kind of research, and put money into these cities and counties and states to educate people and to test people. I'll give you something very, very simple. A number of people, particularly seniors, they can better now do that. Can't afford a glucometer. They've now gotten the prices down to about $19, $20. So the federal government has to just lead it all over. And also, if we can model it here and make it work, we can export it, around the country. The Conference of Mayors, the Governors Association, all the health department directors who are located here. They have an association of all health department personnel at the director level here. So we got to go all out for it. Got to be just a massive. We know this situation is similar to being in the emergency room. We're in the emergency room with this. We have to treat it like it's an emergency. We have to act like it's an emergency and do all we can to push it as an emergency because people are dying. We know that in the black community we eat so unhealthy. We got all these fast food places, I won't name their names, but we know what they are, And so got to be a total mobilization.
So how are you feeling now?
Fantastic. I wake up every morning with a lot of energy. People say I look a lot better, and I think I do too. There were times I wake up, I was lethargic. I didn't want to get out of bed, but I had to because I'm a public official who believes in doing all you can do. And I'd be tired at the end of the day. My skin started getting rubbery and darkened from those toxins being in your body. And now, I told Dr. Calvin last week when I went to see him, I see him every 2 months now. Eventually it'll be twice a year as we go forward. He said, "What have you been doing?" I didn't know how to take that question. He said, "Whatever you've been doing, keep doing it." Because all my numbers look very, very good, thanks to God and a good surgeon like Dr. Calvin and a compliant person like me. I take my pills, about 11 of them, in the morning, every morning. I don't care where I am. I can be on vacation, I can be somewhere else. I take my pills with me. I take my glucometer with me. I'm on insulin. I take my insulin with me. If I don't have it, like about 3 weeks ago, I went to North Carolina on a little short vacation and forgot it for some reason or another. Went to the CVS and got an emergency refill right there on the spot. That's what everybody ought to do.
I'm going to wrap this up, but you are clearly passionate about this, obviously with good reason. And I wonder if in just a really short sentence, what would you say to a young person who thinks he or she is invincible, and so that they could ward this off before they get elderly or even middle-aged and are confronting?
Well, I can't say it on television what I would say in their language. So I'll say basically, I don't know what to say in television language. I know what I would say in the street language, I'd tell you that.
Say it.
What I would say is that's bullshit. You're not invincible. That's not how life is. But all these young people think they're invincible about anything. These people who go out and shoot at people think they're invincible, think they're not going to get caught. So it's a cultural thing, the way they turn around. But I have a good relationship with a lot of young people, and I'm confident from time to time I do talk to them about this subject. But I think it takes the whole society mobilizing to say that's not true. You're not invincible. Look at the people around you that's died from either violence, from this or from that. And look at your mother who has diabetes, and look at the ones who had kidney failure that's on dialysis. Take them around some dialysis patients. Let them tell them the truth about it. Take dialysis patients to our school so people can see that it's not all right to do what they've been doing. Let them tell their story about how they weren't compliant. Let me come tell my story, how I wasn't compliant. That's what it's going to take, and then more. That's what I say to them.